Hi, I'm Dr. Mark Sanna. I'm the CEO of Breakthrough Coaching and a practice management consultant for multidisciplinary practices for 30 years. Welcome to the program. Special thanks to Chiropractic for sponsoring this series of programs on multidisciplinary practice. Let's go to the slides. We're going to discuss in this presentation next level regenerative medicine protocols for osteoarthritis, a chronic condition that can actually be stopped and reversed utilizing the procedures that we're going to share with you today. I'm going to give you a visual tour of Regen Med procedures for OA that actually took place in our Regenerative Medicine Academy training sessions that we perform here in Miami. These are sessions that are performed group and in individual sessions. And if you have an interest in attending one of them, please reach out and we'll be happy to connect you with the Regenerative Medicine Academy here in Miami. So here are the Regen Med protocols that we're going to discuss. For treating severe joint degeneration, osteoarthritis, cartilage defects, structural damage, the conventional treatments of PRP, certainly cortisone, which kind of does the opposite of PRP. Instead of regenerating the joint, it blows it up. These fail to provide long-term regen and certainly not structural integrity. The best regenerative approach is a two-phase, two-fold approach that actually stops, then reverses osteoarthritis. So the first phase, we're going to use something called A2M. And if you're not familiar with M, A2M is alpha-2 macroglobulin. So macro being big, globulin being a blood protein. This is the largest circulating protein in our bodies, yours and mine right now circulating. And it is the cleanup crew in your body. Whenever there's inflammation, body cleans it up with proteolytic enzymes, proteases. And that's a really good thing unless they get trapped in a joint due to scarring. And then what do they eat? They eat your good, healthy cartilage rather than just doing the cleanup. We heat the first draw of plasma, that's platelet poor plasma, before it's centrifuged to create something called bioscaffolding. We're going to talk about that in this presentation. Bioscaffolding of A2M provides immediate cartilage protection. It neutralizes by binding with the proteolytic enzymes and also something called cytokines. Those are the pain-producing elements. And boy, people get immediate relief from A2M injections. You'll call them the next day. They say, I feel better than ever. And you don't normally hear that with PPP. Or PRP, I should say, platelet-rich plasma therapy. It takes a little bit of time to regenerate the cells with PRP, but A2M, because it binds with those cytokines, you get a great response right away. We're also going to, in phase one, include some peptide therapies. Peptides are, talk about next level. Man, everybody's talking about peptides now. You got to know about them. You got to learn about them. BPC-157. That's a great peptide body protecting compound. They call it the Wolverine compound because Hugh Jackman in the movies heals up really quick all the time. So that's the Wolverine compound. NAD+, incredible driver of energy production in the mitochondria, speeds healing, fantastic thing. I should say BPC-157 actually helps in pain relief, but it also is a tremendous anti-inflammatory and stimulator of angiogenesis, new capillary formation. We do this in iontophoresis patch. We're going to talk about why we use iontophoresis patch versus injection therapies. Patches are worn for 3 days in a row to get up to the therapeutic dosage, and then once a week thereafter, and the patient can go on to maintenance levels. Phase 2, 6 weeks after administering the A2M, alpha-2 macroglobulin, we're going to hit it with some Wharton's jelly. And Wharton's jelly is a mesenchymal product. We'll talk about how it's derived, where it's derived from. It's also called Supervesicle Plus, and we also create a Wharton's jelly bioscaffolding as well prior to injection. So Wharton's jelly restores the extracellular matrix, the ECM, provides long-lasting structural support, and it enhances regenerative healing. Cool stuff. A little word about multidisciplinary practice compliance. Now, this program is for educational purposes only. It's not intended to serve as a medical advice for patients or diagnostic guidance for providers. The procedures that are presented in this presentation must be performed by trained medical professionals, so you should consult with your consultant at Breakthrough Coaching and local legal counsel to ensure compliance with all legal and regulatory requirements. So let's take a little tour of the medical procedure room, the setup. I'm often asked, you can see in the corner of the picture here up on the screen, I have to have a sink in my medical procedure room. OSHA doesn't specifically require that a sink is inside every room where a medical procedure like joint injections are performed. However, hand washing facilities must be readily available wherever there's a reasonable likelihood of hand contamination with blood or other potentially infectious materials. So important to know that. Pretty easy pieces of equipment, doesn't take a whole lot of space, typically can be done in the size of a typical chiropractic adjusting room, 10 by 10, 10 by 12. It involves an adjustable exam table that you can see in the middle. You're probably familiar if you've ever had a physical exam in a doctor's office with paper that covers the table. And on the right-hand side of the screen, you see a blood draw chair. That's a great piece of equipment to have. And then a rolling stool. Now, these are all readily available on Amazon.com. They're not expensive for you to have in the practice, and they're certainly going to make life much easier for you when you're in regenerative medicine, in the regen med space. You want a refrigerator, and there are certain things that can be kept at normal refrigerated temperature. Wharton's Jelly BioScaf doesn't require cryo storage. Other injectables, such as injectable vitamins, MIC B12, methionine, inositol, choline, and B12, great for stimulating metabolism and weight loss. Procaine, that's an anesthetic used in prolozone therapy. We're going to talk about ozone therapy in the second part of this presentation. And those things can be stored at refrigerated temperature. Cryogenic liquid nitrogen storage is something that Wharton's Jelly requires. These are live cells. They're mesenchymal cells, and the liquid nitrogen storage container keeps them at minus 196 degrees C. It offers many advantages over having them be in a regular freezer that gets to about minus 20 to minus 80 degrees centigrade, especially for long-term preservation, and if we're using them for clinical applications, as we are. This cryogenic liquid nitrogen preserves viability, stability, the growth factors that are contained in Wharton's Jelly, the biomolecules, activity. In it, of course, if you've ever frozen a piece of meat in your refrigerator freezer, you know that they can form ice crystals, and that's not so great for cellular damage. And the cryogenic liquid nitrogen storage keeps that cellular damage away for months and even years. The unit that you see up on the screen, again, Amazon.com. And where you say, Mark, where am I going to get liquid nitrogen? Guess where? You get it from a welding supply store. They come and they actually service the tank. And you can see how the Wharton's Jelly container is in the little metal cylinder that drops down inside the storage tank. Pretty cool stuff, huh? Ethyl chloride in sterile ultrasound gel. Now, sterile conditions are absolutely important whenever we're injecting the body, particularly when we're injecting into a joint. Ethyl chloride, if you've ever used it for spray and stretch, it acts as a local topical anesthetic during injection procedures. Sterile ultrasound gel also helps ensure sterile conditions throughout the procedures. You should see when we do these procedures at the RMA in Miami, we go through more gloves, surgical gloves, piles of surgical gloves, because of the importance of making sure that we maintain sterile conditions. You're going to begin the process, just as you would in a chiropractic practice, with some orthopedic, also called provocative testing prior to the injection procedures. You'll do, of course, a thorough orthopedic eval. In a multidisciplinary practice, that's typically done by the chiropractor in conjunction with the mid-level to confirm osteoarthritis and assess the suitability for alpha-2 macroglobulin therapy. You'll perform your differential diagnosis. You're going to review the patient's history, and you're going to assess candidacy for further diagnostic testing procedures. Well, your orthopedic provocative testing is going to lead you in the direction that we may have an issue here that could be helped with RegenMed. You're going to need some special testing procedures to confirm that diagnosis. You'll use imaging procedures. Now, both X-ray and MRI can be used to diagnose osteoarthritis in a joint space. However, MRI can directly visualize cartilage, menisci, ligaments, other soft tissue structures in the knee, and it allows for assessment of cartilage degeneration, tears of the meniscus, bone marrow edema, inflammation, all the stuff that you can't see on a plain film radiograph X-ray. X-rays are going to show bone, and you can infer cartilage loss by observing joint space narrowing. But if you want to be even further, more thorough with your diagnosis, send them out for an MRI. If you have a local MRI center, you can negotiate a cash price for folks who aren't insurance covered, typically somewhere between $250, $300, something like that. And it really improves your diagnostic toolkit, I should say. MRI, of course, it's much more sensitive to early, subtle changes in OA, minor cartilage wear and tear, bone marrow lesions, synovitis. These things might not show up on X-ray until the disease is more advanced. And early intervention is everything when it comes to osteoarthritis. We prefer using ultrasound guidance versus landmark guidance when we do our needle injections. So ultrasound guidance, joint injections, they demonstrate consistently higher accuracy compared to landmark, going off the feel and landmarks when you're guiding your needles. Multiple studies, systemic reviews report that the ultrasound allows our clinicians to visualize real-time direct target to the joint space, especially if you're doing a meniscus. That I often say it's important to not just to have the right material, whether it's PRP, A2M, or Wharton's jelly, but it's also really important to put it in the right place. And you're able to document the needle injection as well by screen capturing your ultrasound screen. So the accuracy rates in these studies, typically 90 to 100% when we're doing ultrasound versus landmark guidance. This is my favorite cool toy. It's the Butterfly IQ ultrasound unit. And that's actually my hand right there. So you see how small it is, and you see how it connects right to an iPad, which is awesome. So it's handheld, it's portable, connects to your smartphone, connects to your tablet. You can project it up onto a big screen TV. The images and data are stored on the cloud, it's shared via HIPAA compliance platform, and it has a significantly lower cost than traditional systems. If you've actually purchased an ultrasound unit in the past, you know that they used to be $20,000, $30,000 some years past. This unit, under $5,000. We'll talk about our group purchasing organization for Breakthrough Coaching. You get a discount of $400 off that. So this is an amazing tool, and it can do some great things in terms of viewing, changes of contrast, changes of color. It can turn the needle blue. Cool stuff that helps you in guiding your needles. So let's hop into A2M for a little bit. As I mentioned, it's a naturally occurring protein in your blood circulating throughout your system, doing cleanup. It's a powerful inhibitor of enzymes that break down the cartilage, the proteases, and it helps to protect and preserve your joint tissue. I like to say that when you have osteoarthritis, it may begin with wear and tear, physical wear and tear, but over time, that scar tissue of the joint capsule prohibits the naturally occurring A2M from getting into the joint to denature or bind with those proteolytic enzymes inside the joint. It's like having termites eating up your house. You can paint the house, you can try and fresh it up. If you don't get rid of the termites first, you're going to be in a real situation in a short period of time. So think of A2M as our termite insecticide, getting in there, preparing the ground before we then can add our regenerative products. We have lots of different kits. The kits are the tubes, the connectors that are utilized to create alpha-2 macroglobulin. When I say create, I mean filter it from the plasma. Now, there's lots of kits out there on the market. They are certainly not all created alike. I prefer the advanced A2M Plus kit. First of all, it concentrates the A2M protein. It also, really importantly, removes 99% of the proteases. Most A2M kits do not remove the proteases. And you got to remember, it's the proteases that are the cause, the perpetuating cause of osteoarthritis. This kit also allows for use of smaller gauge needles, as small as a 27 gauge needle. And that certainly helps with patient comfort if you're going into a joint. Quick note on regulatory compliance for kits, both A2M and if you do PRP as well, these kits regulations depends upon their ingredients and their intended use, and they require compliance with device and biologic standards. They have to meet strict manufacturing and safety requirements, and unauthorized marketing can lead to enforcement action. So make sure you have a very reputable source in Breakthrough Coaching. We vet all of our vendor and manufacturer sources for you. In wrapping up, we'll start. Here's the A2M blood draw. You're looking at that screen saying, man, that's a lot of blood. The amount of blood drawn for A2M, it's only about 120 cc's. And after we filter it for red and white blood cells, that's going to result in about 60 cc's of plasma. The first 5 cc's of the platelet poor plasma at that point in time were set aside before the first centrifugation. This is a double spin process for bioscaffolding. We set aside the first 5 cc's. After the second spin in the centrifuge, the A2M is then filtered for the proteases, and it's ready for mixing with the bioscaff and injection. There we go. That's a picture of the blood draw kit for A2M. You can see there's 12 vials, right? 10 mLs per vial. And next step, isolating the plasma. That's, of course, the liquid portion of the blood. You can see it being drawn up inside in our photographs here. That golden yellow plasma is what we're looking for. We don't want to suck up any of the RBCs or WBCs. Remember, we want a nice anabolic environment inside the joint, and putting in RBCs or WBCs are going to continue the catabolic process. We don't want breakdown. We want build up. So we carefully separate the liquid plasma from the other components. We utilize in the tube, in the doctor's left hand holding the smaller tube, the right hand is the golden plasma. These kits also utilize filtering beads, and those are beads to filter out the WCs and RBCs and separate them from the plasma. I want you to know it's much more effective than a gel layer. You'll see some kits that are out there that have a gel layer that actually end up pulling out and withdrawing the materials, whether it's A2M or PPP, that you're trying to get the most of in your filtering process. So we want to make sure that we're not losing any of those important materials. Final note, as I mentioned before, Breakthrough Coaching has group pricing organization. We have a GPO. Our members participate in our GPO, and it provides discounts of really up to 50% of the products and the services that are featured in this program. All of our vendors and manufacturers are vetted for FDA and FTC compliance. They undergo regular testing to ensure that they are in adherence to all required regulatory and industry statutes. Our next level regenerative medicine protocols, part 2, we're going to cover the next steps in the injection of A2M. We're going to talk about Wharton's jelly, preparation and injection of Wharton's jelly. I'm going to talk about ozone and prolozone therapy. We're going to also discuss peptides and some of the cool stuff that you can do to stack, some stacking therapies that help bring your regenerative medicine procedures to the next level. If you're interested in learning more, please join us in our next session. This is Dr. Mark Sanna from Breakthrough Coaching. I hope you make today an exceptional day, and a shout out to ChiroSecure. Thanks again for making this program possible.